Simprints co-authored a paper with IMC Worldwide, which is funded by via COVIDaction. And this was in response to the COVID-19 crisis being felt around the world, and biometrics was highlighted as a potential game changer. Biometrics are a measurement of someone's biological characteristics. They can be physiological, such as fingerprints or iris, or they can be behavioral, like gait or voice. They're generally used to identify someone and to verify that a person is who they say they are. In the paper, we talk about how, for the COVID-19 response, biometrics can be used in the delivery of COVID vaccines, emergency aid, and even when carrying out clinical trials. But biometrics is not a silver bullet, and it's always worth pointing that out. Safeguards need to be in place, planning and benefit risk analysis need to be taken into account to determine whether biometrics are appropriate or specific intervention. So keeping biometrics data secure and ensuring the privacy rights of individuals are respected must be central to any biometric intervention. Reasons why biometrics has become so widely used across the sector is that it's so widely applicable. It can be used as part of everything from maternal health or HIV care through to cash and voucher assistance or even attendance tracking. And this is true in COVID-19 context as well. There's a wide variety of situations where biometrics can be used to verify delivery of services, for instance, and reduce fraud. The paper pulls out three cases in particular as examples where biometrics can have a particular impact in the COVID-19 context. The first is with vaccination. So we know that vaccines are critical to preventing the spread of COVID-19, but there have been a huge challenge in getting sufficient doses to the right people around the world, because it's essential to make sure that every dose goes into the right arm. And also, we know that where especially in the case of something like COVID, where you need multiple doses. So biometrics can help this by tying each vaccine to a biometrically verified record. And secondly, in the case of clinical trials, so clinical trials are important for testing new vaccine treatments or other interventions, but it's difficult to ensure that there is no contamination between trial groups and control groups, and duplicate enrollments into a trial can affect the data gathered. So at Simprints, we've seen fantastic results from clinical trials that have incorporated biometrics, including one study looking at TB and tuberculosis and HIV, which reported an unprecedented lack of contamination between study groups. And thirdly, this COVID-19 crisis has also exacerbated the need for effective delivery of emergency aid. So biometrics can ensure unique registration of participants in the program, unique identification and verification of participants, program tracking. One of the big problems facing programs is the registration of ghost recipients of aid. So biometrics can help to tackle this by giving programs the ability to find potential duplicate records. Our studies have shown us that Simprints increases impact through real-time precision data. For example, increasing maternal health visits by 38% in Bangladesh, or accurate HIV tracing by 62% in Malawi. Today, we've worked in over 17 countries, helping to deliver health aid and finance to over 2 million people. So one of the most exciting things about this trajectory is our deep partnership with governments and digital platforms, which we see as key, we see them as key engines for scale. So we're now in the process of going open source with our technology. And if we're successful, like I said before, our goal is to ensure 20 million people receive health and humanitarian aid by 2025. Yes, biometrics technology can help to scale innovation because it helps identify individuals, especially when working in places where formal identification is not common. 1 in 7 people globally don't have a legal identity. And the identity gap means that healthcare, for instance, is not inclusive, which can hinder large-scale innovations by governments and NGOs. So the advantages of biometrics includes money saved, by reducing fraud, ensuring the right people get the right vaccines and duplication doesn't happen, which reduces wastage, increased accountability, and it can also increase inclusion for poorer populations if a robust identification system exists, which will reduce the need for lots of identification documents, which the poor often don't have. Biometric technology has made it easier has also made it easier to intrude on people's privacy on an unprecedented scale. In many developing countries, privacy laws are limited or even non-existent. So mass biometric enrollments without appropriate safeguardings place individual civil liberties at risk. So, as such, keeping biometrics data secure and ensuring the privacy rights of individuals are respected is central to any biometric intervention. So I think the way we at Simprints have addressed this is by designing from the ground up to be a privacy-first technology. As an organization, Simprints, I've mentioned before, we have a very ambitious goal to reach 20 million people with health and aid by 2025. We want to ensure that every government, every NGO that needs Simprints technology to fight poverty can access it for free. This takes funding, and in order to have our technology go open source, we're currently fundraising for just over £5 million. Millions of dollars of health and humanitarian aid are not reaching the intended recipients. And with our technology, we really want to make a difference, and we really believe that if we take our technology open source, it gives access to those people who really need it, and so that's what we're doing. Like I said, very ambitious goals. A lot of work to do in fundraising for that open source technology, but that's what we believe, and so we're going full speed with that.